So my name's John Hindley and welcome to the Child Accident Prevention session. We're really glad that you've attended, and I know that we've got family support workers, family outreach workers, we've got a nurse principal lecturer and a principal housing officer. So welcome one and all. Sorry about the slight delay. Now we have had, as you would expect, some significant technical issues today, and I don't want to jinx it, but it looks like we've solved them, so we'll carry on with the session. So welcome to the Want to Know More session on child accident prevention. My name's John Hindley and I'll be presenting today with my colleague Sue Mulligan. We work for Public Health Leeds City Council in the Localities and Primary Care team. The session today will be recorded so it can be shared more widely via YouTube, but no participant details will be revealed. For example, if comments are added to the chat box, we'll also have Andy on standby, our technical guru, for any technical issues, depending on how you are viewing the presentation. The session today aims to raise awareness of the most common accidents children have and how they can be prevented. It will provide sources of information and resources available for professionals and families, family support workers, health professionals, housing officers, whoever you might be. And it'll introduce Child Safety Week 2021. Now, obviously, it's been quite a year with the pandemic, and some of the families and the children that you look after, serve, support, help, have had a terrible time. Many of them, I'm sure, along with our community members, will be from deprived neighbourhoods and be in either benefit-driven or quite poor households. So with all of this pressure going on parents, with the pandemic, homeschooling, sometimes child accident prevention is not on their radar for obvious reasons. So the context of the session is to look at childhood injuries are closely linked with social deprivation. No surprises, really. You know, the people we work with sometimes, sadly, live in chaotic households where money is very tight, they're under-resourced, and there is a direct correlation statistically between childhood injuries and deprivation. The Public Health Outcomes Framework vision is to improve and protect the nation's health and well-being, and to improve the health of the poorest fastest. Children from poorer backgrounds are 5 times more likely to die as a result of an accident than children from better off families, and the gap is widening, and it will have been amplified by the pandemic. The framework focuses on 2 overarching outcomes. So outcome 1 is increased healthy life expectancy, taking account of the health quality as well as the length of life and the quality years. Accidents to children can have significant long-term effects on the quality of their own lives, whether they reach their own potential, and how they contribute to civic life and that of their families. A serious scald, for example, can require many years of treatment and cause significant physical and mental distress. Now, outcome 2 looks at reduced differences in life expectancy and healthy life expectancy between communities. Through greater improvements in more disadvantaged communities, there are big differences between the socio-economic groups, and obviously you don't need us to tell you that, in terms of the numbers affected by home accidents. For example, a child with long-term unemployed parents living in a disadvantaged area is 37 times more likely to die from exposure to smoke or flames than children whose parents are in higher earnings or managerial professions. So you'll probably be aware of this, but the Marmot report, and Professor Marmot's quite a famous professional within this area, and he looks at equality, equity in society, how fair society is, equal access to health systems. And the single major avoidable cause of death in childhood in England is unintentional injury, and we use that word carefully. So it's death in the homes for under 5s and on the roads for over 5s. For some communities, I know some of you will have worked with the Gypsy and Traveller community. If you compare their accident statistics with that of the general population, it's quite frightening how many of them have accidents. And a few years ago, I was teaching a group where of 18 moms, and 12 of them had lost children under the age of 5 for various reasons. And of those tragic losses, 60% were from unintentional injury. So it's quite shocking, and obviously poverty amplifies these statistics across the UK and in Leeds. So the Marmot report, Fair Society, Healthy Lives, noted that there are more deaths for unintentional injury, for example, from leukemia or meningitis, and the social class gradient in child injury is steeper than for any other cause of childhood death or long-term disability. The term unintentional injury is used rather than accidents to fully recognise that injuries are the result of events that can be prevented. The report states the single major avoidable cause of death in childhood in England is unintentional injury. Death in the home for under fives and on roads for over fives. And sadly, I know you will have worked with parents who have lost children through an accident, a household accident or an accident in a yard, who are under the age of 5. The Chief Medical Officer reports in 2020, cancer and accidents are now the leading cause of death in children. So that's quite frightening, that accidents is up there with cancer. So this, you can quite clearly see, working from left to right, it gives you the age groups of the children, and you can see how high accidents are. And obviously, as the age group increases, we can see accidents surpass cancer. So it's taken from the annual report by Professor Christopher Whitty, the Chief Medical Officer, who you'll know from the daily updates, and it's leading causes of death in children by age group. The graph shows how accidents are there as one, if not the leading cause of death in children. The blue colour shows 1 to 4 year olds, orange 5 to 9 year olds, where accidents are more common than any other major causes of death, such as respiratory or infectious diseases. In the 10 to 19 age range, purple area, accidents are greater cause of death than cancer. This may be due to road traffic accidents being a higher contributing factor than in the lower age ranges, and other risk-taking activities, for example, swimming in outdoor waters such as canals, unstaffed wild stretches of water such as rivers and reservoirs which have been in the news again already this year. The emphasis how something that in many cases can so easily be prevented is so high up in the statistics, and it is a tragedy. So this data basically just shows both unintentional and deliberate injuries in children aged 0 to 14 years. It's difficult to collect purely accident data, unintentional injuries data, but it does show where Leeds sits in relation to the rest of Yorkshire and Humber region as a whole. Now the trend is thankfully going down, but Leeds is still in the worst 95%. Now I suppose when we talk to parents, carers, guardians, families, children and teams, it's worth gently bringing this to the attention of parents, carers and guardians without obviously scaring them or kind of judging them, but just so that they are aware about child accident safety. That's why we're really glad you're here, and that's why we're really glad that the subject is taken so seriously, because it's so easy to prevent an accident when you're aware of the context and the facts. Okay, so we're going to look at what we can do to help prevent accidents or unintentional injuries. But first, I would like you to take part in a poll to help us understand where you are currently getting information from, if at all. Now, this is really important for us, the Public Health Resource Centre and Public Health, because it allows us to find out where you get your information from. So when I present the poll, please click on one option. You will need to scroll down to see all the options to vote. For those of you who are unable to view this, please add it to the chat, and then obviously if all else fails, you can contact us after us via email. So the question is, what is your main source of child accident prevention information? So I'm going to bring up the poll now. Okay, so you should all be able to see that. So if you want to vote, so where do you currently go to find information on child accident prevention? Okay, so there's some very honest responses there. Yes, Child Accident Prevention Trust, that's fantastic. Now, I'm going to bring a whiteboard up now. Thank you very much for that. I'm going to bring a whiteboard up now. So for those of you that have put other, can you just scribble on the whiteboard? You can just click on the text button and just let us know where you get your information from. So I'm just going to put the whiteboard up now. Okay, so if you wouldn't mind, if you've clicked on the other, oh, fantastic, thank you. And we can save that. Okay, that's great. I'm guessing that's everybody. That's really useful. Thank you very much for putting that down. So we'll just return to the presentation now. We're now going to look at the most common causes of accidents to children, and this can be considered in two ways. Firstly, by the age of a child and what they can be expected to do at this stage. Now, this is a very kind of clever, smart way of looking at it, because the way we live now is very different. And when I started back in the 1920s or whenever it was, the causes of child accidents were slightly different, although there were some similar causes. But the appliances we use, how we live, how households are run. So we have to be aware as professionals and support workers of some of the main causes. So please note, every child's development is different, as you well know. This is just a general guide, and children develop at different stages and at different levels. Many parents are taken by surprise by what their baby or toddler does next. How many times have you heard, "I didn't know they could do that"? Secondly, we can look at the causes by accident risk. So this is a bit like assessing a house or an environment as you would in your work, with accident prevention in mind. As I said earlier, I won't be covering road safety in this session, but there is plenty of information available. It's a huge topic, and that deserves a session on its own. And there's also some resources highlighted later about it. So the 5 main accident risks to children are burns, falls, poisons, roads, and threat to breathing, such as choking, strangulation, and suffocation. Within these categories, causes of accidents have changed over time, e.g. nappy sacks, hair straighteners. I heard a couple of horrible stories about a big sister leaving her hair straighteners on the side that were red hot, and a younger sibling touching them. And also some of the, although there are some safety precautions built into them now, but obviously there's cause from hanging blinds, especially if they're old, over 10 or 15 years old. Are now a cause for concern. They didn't exist a few years ago. Likewise, e-cigarettes and chargers that overheat and button batteries have featured in child safety campaigns. And obviously I hadn't really considered button batteries, to be honest, until again my colleague taught me through it, but they're very small and they do look like sweets, and they can be ingested very quickly, very easily before a parent is aware. Every year, accidents leave many thousands of children permanently disabled or disfigured. More than 1 million children under the age of 15 experience accidents in and around the home every year, for which they are taken to accident emergency units. Many more are treated by GPs and by parents and carers. The children most at risk from a home accident are the 0 to 4 age group. Now, obviously, we should be looking at and focusing as concerned professionals on all age groups, but the 0 to 4 age range is an important one. Falls account for the majority of non-fatal accidents. The highest number of deaths are due to fire. Most of these accidents are preventable through increased awareness, improvements in the home environment, and greater product safety. So this information was from the RoSPA fact sheet, Home Safety Key Issues. So obviously you'll have access to all of these resources. So ages and stages. Looking at now at accidents by ages and stages, we need to consider both physical and cognitive development. A child's physical development means that they may be able to pull a nappy sack over their nose and mouth, but then not pull it away again, or become confused. Their body processes poison differently. Their skin is thinner and frailer, so the results of burns and scalds are more serious. Their heads are proportionally bigger and heavier at this age stage, therefore they're more likely to overbalance and fall. Cognitive development refers to how a person perceives, thinks, and gains understanding. So the child's perspective of the world and how he or she navigates it. So his or her world through the interaction of genetic and learned factors. They have to pull away from something that's burning them. A bit like the age when you put your hands in front of your body when you're falling. Their understanding of risk and the consequences develops over time. They may repeat an action that previously caused them harm until their memory and understanding develops. Okay, so looking at ages and stages, the 5 greatest risks for the under 5s and in the home and garden, if they're lucky enough to have one. I suppose obviously because of especially private rented accommodation, a lot of the families we work with, and I'm sure a lot of the families you work with, will have a small yard or a step or a small area outside. Due to spending much of their time here. During the pandemic, however, we have spent an even greater proportion of our time at home. And also parents have had the added stress of homeschooling. It's been a traumatic time for a lot of our families, especially the poorer ones, especially the ones that are under-resourced, and especially the ones that we're trying to give the very best start in life to. Older children are at greater risk outside the home on the roads as they start to make independent journeys and at play, including in water. And there's a CAPT website for age-related scenarios, which is very good, by the way. 90% of the most serious preventable accidents to the under fives fall into five main areas, which we'll look at now. So looking at accidents and resulting injuries by type, we have burns from example, hot liquids. Now, I mean, I didn't want to do too many case studies or scenarios about horrific child injuries because you've all, I'm sure, heard them, and you know, they are quite distressing. But the one I did want to talk about, which is quite frequent, which I remembered the other day, which is mom is cooking or boiling something, some pasta or some potatoes, or just heating up some soup, and the child reaches up and pulls the hot liquid on them. Now, I've heard that quite a few times, and obviously the mother's been concentrating on the cooking and not seeing the child, or moved away from the cooker or the heater for a second. So that is quite a common one. Hair straighteners, yeah, you've probably all heard examples of children picking up hair straighteners not by the handle and burning themselves, and bonfires. 95% of all child burns and scalds happen at home, which I didn't know that, which is quite shocking, really. Falls, for example, from open windows, stairs, surfaces such as beds, changing tables and trampolines. Falls are the most common cause of accidental injury to children. Most are not serious. Now, the windows in my house, because it's quite an old house, open out, and obviously my son's now grown up, but I mean, they would be an incredible hazard for a child, because you can just get up onto a bed and then just push the window and then you're out. Most are serious, so most accidents are not serious. Children fall over, but some falls can lead to death or disability. Poisons, for example, cleaning products, medicines and plants. Suspected poisoning is one of the most common reasons children are taken to A&E. One of our modern inventions is a liquid detergent capsule, which have become a further risk to children, and are easy to access because they're usually kept under a sink. And I was talking to a couple of clinicians yesterday about from West Leeds Care Partnership, and they were saying they had a couple of examples where a child had nearly, a mom was saying, had nearly got hold of a capsule and put it in their mouth, but the mom had spotted them straight away, and then they'd put a plastic lock across that cupboard so the child couldn't get in. And lastly, threats to breathing, for example, from blind cords, so that getting wrapped around a child's neck and head, and he or she not being able to entangle themselves, nappy sacks and food through strangulation, suffocation and choking, respectively. Right, I'm going to pass you over to my colleague Sue Mulligan now to talk about sources of information.
Good morning, everybody. Thanks, John. So my name's Sue Mulligan. I work in the Localities and Primary Care team in Public Health, Leeds City Council, with John. So we've heard some of the background information on the statistics and causes of childhood accidents. So now let's focus on what we can actually do about it for ourselves, parents or grandparents, or to support the families that we work with. These are the main sources of information we'll be looking at. So we've got the for the Prevention of Accidents, which is RoSPA, Child Accident Prevention Trust, CAPT, Council itself, and within that we've got Child Friendly Leeds, the Leeds Safeguarding Children's Partnership, other partnership working, and then the Public Health Resource Centre. And from the poll that you did, it's clear that some of you, if not all of you, are aware of these sources of information. In terms of finding out information from these sites, you just need to search on onto the internet and you'll find the relevant web pages. So we're looking a little bit more detail at what these have to offer. So first of all, RoSPA. RoSPA, the Royal Society for the Prevention of Accidents, covers a lot more than just childhood accidents, it covers accidents in the workplaces, it covers all different ages, and it does have a much wider variety of information than just child safety. However, it does also have advice and information on preventing accidents to children, which may be topic specific, as John was saying earlier. So, for example, things like burns. It does have safety checklists for use with families for the home and garden. It has videos, which we're going to look at an example of one later. And it does have a dedicated support helpline for families, for parents, carers, guardians, etc., called Lifeline. Because of the pandemic, as everybody's had to work slightly different, at the moment I've checked the latest information. It is staffed a little bit more limited than previously, but so the free phone number's there, but also families, parents, etc. can email for a response. So that's really good, something that RoSPA has dedicated to accidents and accident prevention specifically for families. To show an example of what can be found on the RoSPA website. So the idea after today is, once we've given you the sources of information and resources, if you weren't aware of some of them, that ideally you go away after today and look through the website, see what information is available, because there's so much out there that we're just giving you a snapshot just to show you the sort of things that are available. So as you can see, hopefully from there, there's general information about what sort of injuries occur, where they occur and when accidents happen, or again you can look by type, for example falls, scalds and burns. And then if you can see down the left hand side under the home safety heading, there's specific information around, for example, Christmas safety. And as it states on the page here, most home accidents are preventable through increased awareness, improvements in the home environment and greater product safety. Again, another screenshot, I mentioned the checklist. So this again is showing some accident prevention information based around the home and garden safety checklist. And as you can see from there, you can actually download it for your own use, depending on who you're working with, how you're working. And this again is just a sample of it, just to show you the sort of information. It is general, it's not child specific, but it's still useful for child accident prevention, and the same for the garden one. I'd like to show you a video now showing the dangers of liquid washing capsules, also called liquid tabs or pods, and how children may view things differently. For example, capsules in a box to a child may look like a box of treasure. This gives you an example of a video that can be found on the RoSPA website. It's only a short video, so we'll play it now and then I'll come back to you. Okay, so hopefully you've had a chance to see that. As I say, if it hasn't worked, you'll be able to view it afterwards, either directly from the RoSPA website or from the presentation afterwards if you request the slides. Going to look at CAPT now, which is the Child Accident Prevention Trust, and what they have to offer. It's a dedicated service providing free child safety advice to parents and carers. They support professionals working with children and the families, senior professionals and policymakers, and they advise the government and organisations on child safety. So this very much focuses solely on child safety. Again, it has accident prevention information like RoSPA, it has videos, resources. There are resources that can be bought on there as well, but there's lots of free information. So again, a screenshot just to show you an example of the sort of information you can find here. And again, either by different categories, either through ages and stages, by injury type, such as burns and scalds. And again, button batteries have cropped up on there because it has been a major issue over the last few years. Again, I'd like to show you an example of a video that can be found on this website. If you're opening it directly yourselves, you need to scroll down the page a little bit to actually find the video. This demonstrates quite graphically the dangers from hair straighteners. Hair straighteners can reach temperatures of 250 degrees C, so that's as hot as an iron. And like an iron, there's not necessarily any sign to show that that's still hot. So even when things are unplugged, they still stay hot. And that unfortunately might be when children may grab hold of them. So hot, you can actually cook your breakfast on them. And this video does show cooking bacon. If it can do that to bacon, imagine what it can do to a child's skin. So we'll be talking about what the Public Health Resource Centre offer is later, but they've recently introduced a hair straighteners education pack into their resources as part of their commitment to supporting child safety. So again, if you'd like to either play that directly, or Andy will put a link again into the Q&A, or again, if there's a problem, you can always view it afterwards. So don't forget, if you're doing it directly from the website, you might need to scroll down to actually see where the link is. So I'll leave that one with you for a minute or so. This one takes just over a minute, so if you'd like to watch that now. Okay, so hopefully you've all had a chance to see that. It is quite shocking, but I think sometimes seeing these things so graphically actually gets the message home. To look at a couple of the Leeds City Council sources of information, there's other sources through the council. Some of you, just because of where we're aware of your work from when you've signed up for this webinar, work within the council, so you may be already aware of existing partnerships or work streams. So for example, the Child Friendly Leeds website, and there's a blog on there. There's the Leeds Children's Safeguarding Partnership as well, and again there's a website there. And then partnership working between yourselves with us in public health. There's Best Start, which is for parents and carers. Oh, sorry, the Leeds Children's Safeguarding Partnership at the moment, which is for parents and carers, has information on there at the moment on bath time safety and blind cord safety. So there'll be things added along the way. And the West Yorkshire and Harrogate group at the moment working in partnership, looking at a system-wide response to safe sleep with the aim to improve support for families. And then Best Start partnership working, so John and myself link with the Best Start zones in Leeds. It's a local, citywide, there's also a national project bringing multidisciplinary teams together to ensure that every child's first 1001 days from conception to year 2 are the very best they can be, and that includes those born into poverty. So this allows a child, despite its circumstances, to reach its full potential and contribute to civic life. We have 3 Best Start zones across the city, one in the west, one in the east and one in the south, and child safety is paramount within the partner teams to ensure parents are aware of the dangers and can protect their babies and children from accidents and subsequent harm. And then the Public Health Resource Centre. Some of you may already be aware of this, you may be signed up to it, for lots of information about many different topics. They have training, briefing days like today's Want to Know More session. There's lots of other Want to Know More sessions. As we've said before, this will be put on YouTube, so it'll be recorded. So it means that anybody not able to attend today can access it as well. So we'll give you the details for accessing the Public Health Resource Centre later, so you can see what other Want to Know More sessions are available. They have books, leaflets, training models. Again, because of the pandemic, the access was slightly different, but as we're slowly coming out and things are easing a little bit, they are back to being able to arrange pickups of information. So the Public Health Resource Centre very much is supporting Child Safety Week this year. They've actually purchased on our behalf some additional resources, and as I say, at the end of the session we'll give you the contact information, and I encourage you to register if you haven't already, just so that you're aware of what's available and you'll be notified of new things coming up. So, Child Safety Week, we've talked about CAPT already, and one of the aims of today was very much to promote and support CAPT's Child Safety Week. Some of you, again, because I know of the areas that you're working in, may very much be aware of this, others may not be. Child Safety Week is an annual community education campaign run by the Child Accident Prevention Trust. So it acts as a catalyst for thousands of safety conversations and activities UK-wide. Again, unfortunately, because of the pandemic, the actual activities haven't been possible so much. This year, it's running from the 7th to the 13th of June. And because of thinking that at the moment groups might not be able to come together, although they are just hopefully starting to be able to meet, the theme this year very much is about sharing information. So the theme is Share Because You Care, and that can demonstrate how knowledge is one step towards prevention, because we don't know what we don't know. And as we've said, the world's so different during the pandemic. There's a quote featured on the Child Accident Prevention Trust website from a mum to a 1-year-old little girl, unfortunately, who swallowed a button battery. But her quote is, "Words can't describe how grateful I am for my friend posting of the dangers on her Facebook page." So fortunately, the child survived. She was aware, she knew what to do. So sharing information is what we're asking yourselves to do within your contacts, and there's lots and lots of information on the website for Child Safety Week. So this is a screenshot from the CAPT website, so it shows what they're offering this year and also how to register. So I know just in this last week there's been alerts going out for the resources that are now becoming available, so you will get emails, or you can just look at the Child Safety Week website, but as I say, you'll be alerted as to when new information comes out. So the session cards, you can actually do actual sessions with families covering things again such as button batteries, choking, poisons and burns. They're also looking at providing things in different languages. There is on the Facebook page, if you get a chance to have a look, an offer of a First Aid and Prevention for Burns webinar that's running on Tuesday the 8th of June. It's free, but you do need to register. So if you look on the Facebook page, I'm sure it'll be offered on the Child Accident Prevention page as well. So it's really worth registering with them so that you're aware each year of the Child Safety Week, but also resources that become available. So just to show you some of the resources that can support Child Safety Week this year, but also ongoing child accident prevention work that you may be doing. The Public Health Resource Centre, as we say, are very much supporting us this year. So look on their website directly, but this is just to show you some of the things that are available. So there's booklets around preventing accidents, there's training packs, CDs, etc. So those are some of the ones that have existed already, but then there's some new ones that have been bought in specifically this year. So if anybody wants to make a display, for example, in their setting to support Child Safety Week, then you can order those individually. Posters, for example, are available, leaflets, so that you can actually make presentations yourselves. We've tended not to do actual packs because people want to pick and choose what's most suitable for their environment that they're working in. But these are now in the resource centre. They're just new in last week, so you can see and order what you like from there. The other thing that myself and some colleagues in the council have been working on before the pandemic, and then it was put on hold last year for various reasons, was the potential to develop a safety calendar for organisations to access. So you're probably aware that there are campaign calendars out there for things that happen across the year, but we wanted to produce one that would focus specifically on accident prevention, so very specific. And we wanted to take this opportunity as well today to ask for your thoughts on this and some feedback about how you think it would be useful, how you would like it structured, whether you would like it by theme, by topic, whether there's an actual campaign available. So, for example, we might decide to do summer safety as a theme, but within that topics might be things like drowning, barbecues, sun safety. So I'm sure you may be aware that there is actually a campaign, Sun Awareness Week. So what we're asking of you really is just some feedback, how you might like to access it. For example, would you like it as alerts as things come up? Would you like to see a calendar for the whole year with links? So any comments that you can give us now would be greatly received and then considered for how we go forward with this. So unfortunately, although it was put on hold, it now does give us an opportunity to ask for your feedback on this. So I'll put a whiteboard up, and as before, if you'd like to make any comments on that, if you could please. So just by clicking on the top right corner, that'll give you access to typing. So any comments whatsoever on this would be really gratefully received, and we will save all these comments to help us with the way forward. So if any of you'd like to make now, please, I'll just give you a few minutes to do that. Okay, thank you. So hopefully myself and other colleagues will be working on this in the near future, and then we will get the information out to you. Okay, so thank you for that. Just to finish off then, as we said, if anybody wants copies of today's slides, then if you just email Public Health for All to request them. You will have had an electronic evaluation survey for today's sessions emailed already, so we'd really appreciate it with any feedback on there if you could. As we said, the Public Health Resource Centre has lots of information, training, etc. So visit the website. That link is specifically for the training pages, but then also look at the website in general and definitely register. In terms of Child Safety Week, definitely register for that, and it would be interested if anybody could feedback to us if they've actually run any sessions, put up any displays just for our own interest within public health in the council. That'd be really useful to know. We've finished about 10 minutes early. If at this point you wish to leave the session, that's perfectly fine. If anybody wants to stay on, Andy can actually unmute microphones, so if anybody at this point wants to ask any questions or discuss anything, we'll stay on the webinar for a few more minutes till the end of the session. But I'm sure so many of you are busy and you're between meetings or whatever, so if this just gives you 10 minutes opportunity to maybe look at the websites that we've mentioned, start to look a little bit through the information that's there, you've just got a little bit of dedicated time to do that before you need to rush off to do whatever you've got on next. So again, thanks very much from myself and John, and
yes,
thanks to Andy for helping us out. As I say, we will stay on, and thank you.
That's great. Thank you very much for coming. It's really appreciated. And we know from the stories that come back through our partnerships that if you just mention a little bit about child safety, it does go round and moms do talk to each other and they do share it on Facebook. So no conversation is wasted about child accident prevention and unintentional injury. But thank you very much.